The world is shocked when COVID-19 pandemic hits globally. It is reported that the COVID-19 coronavirus infection emerged in Wuhan, China at the end of December 2019. Scientists say that it is highly likely the virus came from bats but first passed through an intermediary animal in the same way that another coronavirus, the 2002 SARS outbreak. One animal implicated as an intermediary host between bat and human is the pangolin. The number of COVID-19 cases worldwide has exceeded 7 million and it also has caused a number of deaths exceeding 400,000 worldwide. The COVID-19 pandemic has shown how dangerous and fatal is a disease that was caused by animals. In Malaysia, there are certain diseases that are caused by animals and they have quite a large number of cases. The cases for dengue fever, malaria, leptospirosis and rabies in Malaysia show quite high numbers, some of them causing death. Individuals should suspect dengue when a high fever, 40 degrees Celsius, is accompanied by two of the following symptoms: severe headache, pain behind the eyes, nausea, vomiting, rash, swollen glands, and muscle and joint pains. Symptoms usually last for 2 until 7 days after an incubation period or 4 until 10 days after the bite of an infected mosquito. According to Dr. Katrina Lau, in Malaysia, dengue is the most common and it is a vector-borne disease caused by the dengue virus and carried by mosquitoes. Other diseases that are commonly seen in our country are leptospirosis, caused by bacteria and carried by rodents. Malaria is caused by parasite carried by mosquitoes, while rabies is caused by virus carried by infected dogs. She added that infection from any of these diseases, if untreated, they can be lethal. Humans will only get infected if exposed or come in contact with a vector carrying the disease. For example, if you are bitten by mosquitoes carrying dengue virus, you contract dengue but not other disease. For dengue and malaria, if you are bitten by the mosquito, not all mosquitoes, only if the mosquitoes are carrying the virus or parasite. For leptospirosis, if you are in contact with rats' urines, the bacteria in the urines can infect you if you have a break to your skin like wounds or any openings. So sometimes if you waddle in a pool which is contaminated by rats' urines, you are at risk of getting leptospirosis. Same goes to rabies. As you all know, if you are bitten by an infected dog. Hence, she said that if you are infected, you should seek treatment as soon as possible. Delay in treatment can end up with various complications which, if the person survives, there may be certain damage to some major organ, for example, lung, kidney or brain. However, most of the time, patient will have full recovery. Again, it depends on which infection you contract. Rabies has a poorer prognosis. As these are vector-borne diseases, the best way, of course, is to prevent ourselves from being infected by avoiding them. Mosquitoes, we should keep our environment clean to prevent breeding. Use of repellent if you have to go out and also avoid going outdoors during their most active time. For example, Aedes are the mosquitoes carrying dengue, love to bite at early morning and evenings. For malaria, if you have to go to a high-risk area, apart from repellent, you can take oral prophylaxis, which is a medicine to help protect you. The dengue vaccine was introduced some years ago. However, for Malaysia, we are not using it yet. The outcome is still debatable. Dogs can be vaccinated to prevent them from contracting the disease and thus transmitting it to humans. In addition, according to Dr. Salina Hamid, infection of animal disease are very dangerous and can cause death. All the disease will attack the system in the human body and destroy it. For example, dengue fever, the virus will destroy the platelet and cause bleeding, while rabies will attack brain tissue and cause convulsion. Dr. Salina said hygiene is very important to control the disease. Leptospirosis is the virus spread via rat urine. When humans have contact with contaminated water or surrounding areas, he will get the disease. For dengue and malaria, the virus are spreading via mosquitoes, so destroying the breeding areas is very important.